This extremely high yield hematology review can give you easy bonus points on exam day. Chromosomal translocations is a topic that is not only high yield for the USMLE Step 1, but also the USMLE Step 2 CK and the USMLE Step 3. So if you have any of these exams coming up, I highly recommend that you sit back, relax, and watch this high yield review until the end. I'll also include a quiz and NBME style question so that you can test your knowledge and also for the sake of repetition. So let's begin. First, let's focus on the lymphomas: Burkitt's lymphoma, follicular lymphoma, and mantle cell lymphoma. So I'm going to make remembering all of these chromosomal translocations as easy as possible. So for all lymphomas that are commonly tested on the USMLE, they all include chromosome 14 translocations. This is extremely high yield to remember. And there is one lymphoma that is an exception that we will talk about soon. So as you all know, these chromosomal translocations usually occur between two different chromosomes, right? So fine, we know that the lymphomas include chromosome 14 for all of them except one. But what about the other chromosome? How can we remember that? Well, let's take a closer look. So if you look at Burkitt's lymphoma and you think about or picture the B looking like an 8, that lets you know that for Burkitt's lymphoma, the translocation that occurs there is 814. Another tip is that for translocations, the bigger number always comes at the end. So for Burkitt's lymphoma, it would be an 814 translocation. However, let's take a closer look at mantle cell lymphoma. If you picture the L's in cell looking like the number 11, that lets you know that for mantle cell lymphoma, it has an 1114 chromosomal translocation. Now let's take a closer look at follicular lymphoma. So for this one, you have to kind of think about it like follicular lymphoma, and this lets you, of course, remember the number 4. But what's unique for follicular lymphoma is that it does not include a 414 translocation. So it kind of just doesn't follow the trend that we've been doing so far. But don't worry, I will show you how you can remember this lymphoma translocation. So all you have to do is just add the number 4. So like I said, follicular lymphoma, and remember all lymphomas except one include the chromosome 14, right? So once you add 4, that gives you chromosome 18. And like I said, the bigger number always comes last. So for follicular lymphoma, that would be a 14-18 translocation. So let's quickly recap the 3 chromosomal translocations that we have mastered so far. So remember, all lymphomas except one include chromosome 14. For Burkitt's lymphoma, we think of the letter B as the number 8. So Burkitt's lymphoma, that is a 814 translocation. Mantle cell lymphoma, again, includes chromosome 14. We think about the L's in cell as the number 11. And mantle cell lymphoma would be a 1114 translocation. While for follicular lymphoma, this one goes against the grain or against the trend that we've been talking about so far. But all we have to do is just add 4. So 4 plus 14, 18. So for follicular lymphoma, that is a 14-18 chromosomal translocation. So now that we have mastered those 3 lymphomas, then let's take a closer look at the exception that I mentioned before. So that exception is marginal zone lymphoma. So for that lymphoma, it does not include the number 14. So how I remember this is that it basically entails the chromosomes of the smallest number in mantle cell lymphoma and the largest number in follicular lymphoma. So I kind of use the arrow to make sense of what I'm saying, and that would be an 1118 translocation. And there you have it. 4 lymphomas, including all of their translocations, and a pretty easy way to remember them all. There are also some other key points that you have to know about the lymphomas, and they have like different markers that the USMLE loves to test. So just for some bonus points here, let's go through them. So for Burkitt's lymphoma, that includes c-MYC overexpression, which leads to cell growth. For mantle cell lymphoma, that includes cyclin D1 overexpression that causes cell cycle progression. And for follicular lymphoma, this includes BCL2 overexpression, which causes apoptosis evasion. If you have any mnemonics to remember these, then please leave them in the comment section below. That would be amazing. But for now, I highly recommend that you pause the video here and take a good look at this section and really try to remember the overexpressions for the lymphomas. So next up, we're going to take a look at the leukemias. So for CML or chronic myeloid leukemia, we would think about cream cheese. And it's not hard because when you think about the C and the M in chronic myeloid leukemia and the C and M in cream cheese, you can kind of make a quick connection by using those two letters, right? So why is it important to remember cream cheese as CML? Well, remember that brand of cream cheese, Philadelphia cream cheese, right? Well, that will let us remember Philadelphia chromosome. But a key thing that we can do here is to think about the P in Philadelphia like the number 9. And that lets us know the chromosomal translocation, right? Which is 922. So you're probably thinking, okay, great. CML, we remember the Philadelphia chromosome or the cream cheese, and the P in Philadelphia lets us know the number 9, but how can we remember the number 22? Well, if you count the letters in chronic myeloid leukemia, there are 22 letters in all. So that's how we remember the number 22. So remember, CML, Philadelphia cream cheese. Think about the P as a 9, and that gives us 922 chromosomal translocation. Another high-yield point to note is that this 922 chromosomal translocation leads to the formation of a new gene called BCR-ABL1. And this is an extremely high-yield association with CML. Another high-yield point is the translocations for AML and ALL. So for AML, that includes translocations between chromosome 15 and 17. While for ALL, that includes translocations between 12 and 21. So I don't really have a cool mnemonic to remember these translocations, but I do have a mnemonic for you to remember the extremely high yield points that are tested for AML. And we can use the letters in AML to remember these high yield points. So the A for air rods that are seen, and M for myeloperoxidase positive, and L for leukemia, of course. So if you remember this mnemonic AML, that can also give you some bonus points on exam day. So I just mentioned the air rods. So I have to highlight this image, and you can see the little black arrows there pointing to those rods that are associated with AML. And just remember, R rods, myeloperoxidase positive, and L for leukemia. The 15-17 translocation in AML leads to the production of this, which is PML and RARA, or RARA. Okay, so those are the extremely high yield translocations for leukemias and lymphomas. Now let's head into the quiz and the NBME style questions. So for the quiz, you're going to see translocations or terms, and you have to figure out which lymphoma, leukemia, or hematological disorder it is associated with. So let's get into it. Chromosomal translocation 814. Burkitt's lymphoma. So remember, we think of the B as an 8. And for all lymphomas except for one, they include chromosome 14. So for Burkitt's lymphoma, translocation 814. And next, 1221 chromosomal translocation. ALL. So for this one, unfortunately, I did not have a mnemonic to remember the translocations, but you can kind of figure it out with the process of elimination. It does not include the number 14, so it's not a lymphoma. And like I said, if anyone has a mnemonic for this, I would greatly appreciate you. Just leave it in the comment section below. And speaking of comment section, if you are enjoying this video so far, please be sure to power up the like button, hit subscribe, and that notification bell so that you never ever miss another video like this. Okay, next, 1122. And yes, I know I did not mention this translocation so far in this video, but I definitely had to put this in for the purpose of completeness. So this is Ewings sarcoma. 1114. Mantle cell lymphoma. So you see the number 14 there, so you know it's the lymphoma. And remember the cell in mantle cell? Just think of the two L's as the number 11, and that lets you know that mantle cell lymphoma includes translocations 1114. Okay, 922. CML. So remember, we think about the CM like in Philadelphia cream cheese, and then the P in Philadelphia, think of it as like a number 9. So that lets you know that chromosome 9 is involved. And remember, when you count the letters in chronic myeloid leukemia, there are 22 letters. So that all lets us know that it includes chromosomal translocations 922. 14-8. Follicular lymphoma. So remember, 14 is there, so it's probably a lymphoma. But remember, follicular lymphoma. So we add the 4 to the 14, and that gives us a 14-18 translocation for follicular lymphoma. 11-18. Marginal zone lymphoma. So this is one of the exceptions to the whole chromosome 14 rule. This includes the 11, which is the smallest number from mantle cell lymphoma, and 18, which is the largest number from follicular lymphoma. So let's move on. BCL2 overexpression. What is that associated with? Follicular lymphoma. BCR-ABL rearrangement. CML. c-MYC overexpression. Burkitt's lymphoma. Cyclin D1 overexpression. Mantle cell lymphoma. PMR, RAR oncoprotein. Acute promyelocytic leukemia. So that was a very high yield quick quiz so that you could remember everything that we talked about so far and learn some new things too. So let's move on to the NBME style questions. A 46-year-old male presents with fever. The physical exam reveals a 3 cm non-tender cervical lymph node. Previous follow-up visits reveal that the lymph node fluctuates in size but does not disappear. What is the underlying cause of this patient's diagnosis? A. Overexpression of NMYC. B. Overexpression of BCL2. C. Overexpression of cMYC. Or D. Overexpression of cyclin D1. So for this question, we have to know what is the diagnosis first, what is the underlying cause of it, right? So this patient has a mass or an enlarged lymph node that is fluctuating in size. Typically, this is described as a waxing and waning, which is extremely high yield, and it is associated with follicular lymphoma. So great, we know the diagnosis of follicular lymphoma, but which one of these overexpressions is associated with it? Well, let's break it down. So for overexpression of NMYC, that is associated with neuroblastoma. Overexpression of cMYC, that is associated with Burkitt's lymphoma. Overexpression of cyclin D1, mantle cell lymphoma. So of course that leads us with answer choice B. Overexpression of BCL2 is associated with follicular lymphoma. So let's say I asked you a bonus question of what translocation is associated with this diagnosis. What would it be? And if you said a 14-18 translocation, then you are absolutely correct. Remember, most lymphomas include chromosome 14. Think about follicular lymphoma at the port of 14. That is a 14-18 translocation. Now let's move on to the next question. So if diagnostic studies reveal an image such as this one, what is the underlying translocation that can be associated with this disorder or this disease? Is it A chromosomal translocation between chromosome 9 and 22, B, 11 and 18, C, 12 and 21, D, 8 and 14? So for all the different steps, USMLE Step 1, Step 2 CK, and Step 3, images are always going to be high yield. So if you know the images, that can definitely save you time from reading extremely long question stems. But if you see an image like this, it's imperative that you know that this is associated with Burkitt's lymphoma. So in this image, you can see the classic starry sky appearance. So now that we know the diagnosis, what translocation is associated with Burkitt's lymphoma? Well, let's take a closer look. So for A, 922, that you have to remember Philadelphia cream cheese, right? So think about the P in Philadelphia as a 9, and then the letters in chronic myeloid leukemia are 22. So there are 22 letters. So that is 922 for CML. And for option B, that is marginal zone lymphoma. Remember, it includes the smallest number from mantle cell lymphoma, which is 11, and the largest number from follicular lymphoma, which is 18. So that is an 11-18 translocation. Option C, 1221. I don't have a mnemonic for this, but that is ALL. And finally, option D, 814, and that is the answer. Remember, we think of the B in Burkitt's as the number 8, and remember that basically all lymphomas except one have chromosome 14. So 814, Burkitt's lymphoma. Next up, question number 3. What translocation is associated with this condition? So first we have to know the diagnosis again, and that is follicular lymphoma. So this is an extremely high yield image. So let's look at the options. A, 14-18, B, 11-18, C, 12-21, or D, 8-14. So option B is mantle cell lymphoma, option C is ALL, and option D is Burkitt's lymphoma. So that leaves us with option A. Follicular lymphoma. And how can you remember follicular lymphoma? Well, like I said, all lymphomas except one include chromosome 14. You think of follicular lymphoma, you add 4 to 14 and you get 18. This is maybe the 5th time I'm saying this, but I know that all of this repetition will definitely help you to remember on exam day. So let's move on to the final question. A 44-year-old male presents with fever and a sore throat. Bone marrow biopsy reveals predominance of immature myeloid cells with azerophilic needle-shaped cytoplasmic granules. What would chromosomal analysis of these immature cells reveal? 8-14 translocation, 15-17 translocation, 14-18 translocation, or a 9-22 translocation. So let's break down how to get to the answer here. So in the question it says immature myeloid cells with azerophilic needle-shaped cytoplasmic granules. So that is the classic description for air rods, right? And remember the mnemonic AML. A, air rods, M, myeloperoxidase, and L for leukemia. So we have to then find out which one of these translocations is associated with AML. Okay, so option A, of course, is Burkitt's lymphoma. B, looks like 8, lymphoma, chromosome 14. Option C, follicular lymphoma. Lymphoma, chromosome 14, follicular, add 4 to 14, 18. Option D, 9-22, which is CML. 9 from Philadelphia chromosome and 22 for the number of letters in CML. So that leaves us with option B, a 15-17 translocation. So if you have any questions or mnemonics, then please leave them in the comment section below. That would be awesome. And if you would like me to review any other topics, then you can leave that request in the comment section and I will definitely make a video about that. As always, if you enjoyed this video, pour up the like button, hit subscribe, and that notification bell. And to continue learning more, then click this video right here. Thank you so much. Bye.